Of course, it will be a relaxation. No one's expecting it to end. You know, we're going to have to coexist with this virus for I think many months, if not potentially years. But we've got to find a way forward, and that does mean you're relaxing as much as you can, running the economy hot, you could say, in a way that you are trying to take into account not just the sort of necessity to control the virus, but also the wider impact on society, those job losses, those opportunities foregone, particularly for younger people, the rise in domestic violence, child abuse, mental health cases, all of that needs to be taken into account.
When you talk about running the economy hot, do you mean that we need to run it close to the reproduction rate of one of the disease, i.e. open it up as much as possible to try and limit that longer economic damage?
Yeah, I think we just need to, as well as listening, of course, to the scientific advice, and also actually taking into account that the scientists themselves sometimes don't quite agree on what the best way forward is. But as well as listening to the scientists, we also need to, as we are, think carefully about the impact on the rest of society and the economy and jobs and wider social impacts. And that does mean, I think, that when it comes to opening up, you want to go as far and as quick as you can.
There's obviously been some debate as to the pace of lifting the lockdown. What do you want to see then next week as a bare minimum?
What I would like to sort of feel is that ministers are going as far as they possibly can, taking into account all the factors, not just the science, but the impact on the economy as well.
President Trump said that Americans may have to accept a greater loss of life as a price of getting the economy moving. These are his words. He was asked, will some people be affected badly? And he said, yes, but we have to get our country open and we have to get it open soon. Does he have a point there?
Look, I think many countries, and it's not just us in the United States, look at our European friends, they're grappling with this, about what exactly is the right response. If you go too fast, if you open up way too fast, the numbers might rise again in terms of deaths. And so you need to be wary of that.
The public need to know, don't they, that there are really brutal trade-offs in all of this. All the choices are horrible choices. But that we might have to live with some level of mortality around COVID-19, some level of death in our society.
One day there'll be a vaccine, but I don't think anyone can say when that will be. It could be months, could be years away, who knows. And I hope, of course, it's a lot sooner, but in the meantime, we need to just plan to live with this. For example, we know now that the mortality rate of younger people, let's say under the age of 45, is a lot lower than others. And it might be the case that in the future we can find a way that we focus our protection on those that are most vulnerable, those that have underlying illnesses, but give more freedom to, let's say, younger people so they can get on with their lives and at the same time help the rest of us by rebuilding our economy, which benefits everyone.
So do you think that one option could be, in terms of trying to open the economy but protect life, that basically the vulnerable in society and the over 70s might have to have a different set of rules to everyone else, and that will be a sacrifice that they have to live with?
We're learning all the time, but we shouldn't rule out an option that focuses on protecting the most vulnerable, but gives more freedom to others.
So we are going to have to treat different age groups differently?
You may have to.
It's sort of like some people making sacrifices for others, just as in everyone made a sacrifice in locking down to protect life. I mean, these are things we all have to do together as a society, if you like.
Well, it's been tough for all of us the last few weeks, but I think one of the things that we certainly, as a society, I think we can feel very proud of is that how everyone has come together. They've done their bit, whether that's by staying at home, but particularly, I think, the health workers that have basically they've put their lives at risk so they can look after the rest of us, and that is something I think we'll never forget, and we'll want to find, I think, as a country, a way to recognise the sacrifices made by those in health in particular, but more broadly in emergency services.
Which leads me to the next obvious question. Do you think the government should give nurses a pay rise?
Well, I think that nurses, doctors should be recognised and rewarded in some way, and that is certainly one way to do it. But if you are going to give a pay rise, you also want to be sure as a government that you can sustain it on a permanent basis for many, many years.
How on earth are we going to pay for it all in the end?
Many things will change as a result of this crisis. One thing that shouldn't change is our understanding of the economic model that leads to the highest growth rate possible, which is still going to be a free enterprise, low tax, competitive economy. This is the best way to make sure that we are earning enough as a country to pay for the public services we all rely on. It was true then, and it's true now, and that's going to be critical, that we stick with the economic model that we know that works.
So, in terms of tax rises, you don't think that there should be any tax rises to help pay for the debt that we're piling up?
I think we should try to avoid tax rises simply because it's self-defeating. If you have taxes that are rising, especially if they rise significantly after this crisis, it will strangle any economic recovery.
I mean, the other way you manage debt is you try and constrain public spending. Do you think we will have to return to some sort of austerity?
You can only spend what you've got. That you can't continuously, sustainably keep borrowing. And so we will have to bring finances under control. But again, I think the best way to keep spending what we need on the public services, whether it's NHS, it's schools, all these things that we rely on, is to focus on the growth of the economy and not higher taxes.
Finally, this is your first television interview since you resigned as Chancellor in February, asked to sack all your advisors. You just said, I'm not prepared to do that, and you decided that you'd rather leave that job than work under those conditions. Do you regret that decision now?
No, I've said what I wanted to say about that. I made a statement to Parliament. I thought that was the right way to set out why I left government. I don't regret anything. And I want this government to do incredibly well and to succeed, and I'm going to continue to help in every way that I can.